Thanks for staying with us. So Tuesdays, we always have to touch on health topic. Therefore, joining us to discuss reducing out-of-pocket health service for affordable and quick access to quality health delivery, and to explain, Ilera Eko is the General Manager, Lagos State Health Management Agency, Dr. Emmanuella Zamba. Welcome to the show.
Thank you. Thank you for having me.
When I saw out-of-pocket expenses, that is me, number one. I'm constantly paying because I've not found that right insurance for my family, because I have a large family. So I want somebody that can cover my entire family. So what is Ilera Eko, and what information do you have for us, for our viewers today concerning Ilera Eko?
Thank you. So I'll start by saying that it is a law that was established in 2015, although we didn't really start until 2020. And that law empowers the agency, which I come from, to propagate a scheme. It's called the Lagos State Health Scheme, but it's actually a social health insurance plan. And the plan, the scheme contains not just what we're offering as a social plan, but also even all the private health insurance plans that are in Lagos. We do know that we have a preponderance of private health insurance in Lagos, largely for the corporate sector. So part of our role is also to regulate that space to ensure that people get value for money, people are not disenfranchised when they buy into the private health plans. But of course, we know that these private health plans are really expensive for the average person. So the informal sector, which is like 70% of us in Lagos, is the largely uncovered, really. And so if you don't have something that's affordable for them, they will not get health insurance. So that's why we step in and we bring up this social health plan, which is called Ilera Eko. Literally, it's to get the informal sector to understand that we're talking about your health, buy into it, and you'll have quality. So it's more or less a call to action for them. And we have the most affordable plan that you can get anywhere in Nigeria, actually. I don't think there's anyone that's selling something lower than what we're selling with regards to the quantum of the benefits inside that package. So that's what we're about.
So I learned about the Ilera Eko and the entire Lagos State Health Insurance Scheme from a friend who works with you, Mrs. Eniola Banjo. And I had a difficult time selling it to another, Nigerian who's not that educated. One of the things she said was, when we go now, they will say we should bring LASHMA. They will say we should bring NIA. Shame me now, in my old age, I'll go and queue for that. So what exactly are the requirements that, and how easy to register is it?
Okay, excellent question. So because it's a social plan, you're not really supposed to introduce barriers that won't let people come on board. The essence is to get people to come in. So we know that not many people have the LASHMA card, although it's something that we should get as Lagosians. But however, if you have evidence to show that you live somewhere, you have your rent or your NEPA bill, your water bill, something like that, that shows where you live with your name, you'll get registered.
Interesting.
So maybe if you have a tax...
Exactly. Anything that gives us evidence that you actually reside in Lagos.
Sorry, Doctor, I wanted to ask, because a lot of these insurance plans, they only treat malaria and typhoid.
Exactly.
Basic health.
The real treatments that you need,
terminal disease,
cancer, high blood pressure, insurance don't cover it. I can treat malaria even by just going to the chemist.
Well, I think Lagos is a little different in terms of the government. We did a survey to look at what people actually need in terms of healthcare. So what do people normally walk into a facility for? And so this plan covers about 80% of that. We do, as you mentioned, malaria, typhoid, fever, diarrhea, childhood illnesses, all that is under the plan. But we also go a step further. You can get your antenatal care free. You can have your delivery done free, whether it's cesarean or it's normal delivery, it's free. You can get blood transfusion, it's free. You can get admitted for about 15 days in a year, and you'd get a meal a day under the scheme.
Only?
Every day.
If I tell you the amount now, then you'll know that, man, it's really good. It's a good deal. You can also get surgeries done, so appendectomy, herniorrhaphy is also under the scheme. You can get your lab test done, X-ray test done, ultrasound scan. You can see a dentist. Exactly. That's the better question. You can even get glasses. You can get specialist consultations, at least 4 different specialists in a year, and so on and so forth. So you can see it's really robust. And it's for a paltry sum of 8,500 per year per person.
Per year?
Per year per person.
Yes.
Yes.
My parents did. They have a family.
Yes, I remember. Someone sent me the video and was like, somebody has given us validation on TVC.
We paid 40,000 naira for a family of 4. My dad and the 2 people, my dad, my mom, and 2 people that stay with them. So I know that there was, when I read the details, it was pretty robust, and I felt, oh, this is amazing. Let's get on this for them. The challenge, though, which I must say, was the hospital that was first recommended later said they wouldn't accept the cover anymore. The hospital is a first stack, and that maybe they had issues. So we've had many insurance people come up, even the NHI, NHIS and all of that, that after a while, there will be issue of repayment. So the hospital themselves will be like, I don't want to deal with this insurance, because when we file for our claim, the funds that should come to us don't come through. So how can you assure Lagosians that there wouldn't be such administrative issues when they use Yes.
Okay, so that's a really good question. We have what we call the Lagos State Health Fund. It's ring-fenced, and that's where all the funds for health insurance go into, and it's not used for anything else at all. Now, we learned from some of the mistakes in the health insurance industry, and we decided that we didn't want to go through a third party to make payments. So money should come directly from that fund to whether it's a provider or whether it's to someone that's a marketing agent. We would make those payments directly. So we do have an entire retinue of staff responsible for ensuring that capitation is paid within the first week of the month, so that people go to the hospital and they can get care. And that when you send in your claims as a provider, that is processed. We have a tariff, and we have an entire retinue of staff. We are even working with private people to ensure we're a bit more efficient. So we have some HMOs, for instance, that are working with us as third-party administrators. They just vet the bills, but the actual payment comes from that fund, and there is an entire office.
Many providers would like to find out how long does it take to get paid. That's another issue, because there's one that spoke to me. They said that, Maria, when I file my claims, I don't get it 8 months. Sometimes I'm still looking for claims. So that's a major issue, because we want to subscribe, but our doctors would dissuade us from subscribing. Don't use them, use this other person. So how is the processing?
Okay, so capitation, as I said, is more or less like clockwork. You get that within the first week of the month. You get your payment for the people that walk into your facility. With regards to the claims, sometimes some of the fault is on the side of the provider. For instance, if you don't send in your claims when we've asked for it there's a certain deadline, then you can't expect magic for your payments to now come out, Right. But we do try not to have a lag, because it's, unlike capitation that is supposed to be paid upfront, claims is after the fact. So usually we try not to make it extend more than like 2 months before you get remunerated for whatever claims you sent in. We do have like an SLA that we sign off on with them and make sure that we try to keep to that.
Okay, so if I am already used to a particular hospital and I do not have a close general hospital, because in the whole Odofi, apart from the mother and child, there's no such government hospital. We only have primary healthcare centers. So can I then bring in my hospital, if it's not listed as, as where I would like to continue my healthcare service under this plan?
So let me first of all correct the impression that it's just public hospitals. We work with both public and private. In fact, right now we have a lot more private than we even have public facilities working with us. So it is very likely that you would get a private hospital around where you live. However, we also have a window whereby either on the recommendation of a client, or even we have divisional offices. So our officers go out scouting for hospitals, so that people, we're trying to reduce cost of accessing the care in terms of transportation and things. So they go out scouting, and when we see those kind of hospitals, we talk to them. You can even get hospitals, we train hospitals to have a staff that when you walk in, they can register you, they can collect your payments, and they even get a commission for doing that. So yes, it is possible that once you give us that recommendation, we go to the hospital and we have this sort of arrangement with them.
If it's 8,000 per head,
8,000.
and I went to, my staff, I have a large workforce. I want to register all of them under this scheme so that they can get this free medical treatment. Is it possible?
Very possible. So we're very big on, because that's how you gain quantum in terms of the number of people you're covering. So we welcome groups, we welcome associations, we welcome SMEs, MSMEs. You're very welcome.
So how would I do that? exactly like when I get to the office today, I'll say, okay, Mary, we can do this. Can you
reach out?
So where would we go?
Okay, so, I mentioned the fact that we are concentrating a lot on informal sector because there's really nobody that is looking after them. So we have grassroots offices. We have 5 divisional offices in the 5 divisions of Lagos, and we also have sales kiosks scattered across Lagos. But the easiest thing is to just call our call center, which is 24 hours, and we have toll-free lines, 0800 Ask LASHMA and 0700 Ilera Eko. You call us at any time, and they'll walk you through what you need to do. We have an entire sales force, over 200 people, actually, spread across. And they can come to your office or wherever you want them to come at the drop of a hat, and they come and make the presentation, and then they'll walk you through how you get registered and get enrolled.
So one last detail quickly. When the old NHIS plan was there, you have civil servants enrolled, and then when they had a particular procedure, let's say myomectomy, for instance, they'd say, okay, you as a patient pay a percentage, and then the covers another percentage. Is that how the health insurance scheme works, or you cover full?
So once it is a listed benefit, we pay everything. If it's not in the benefit, then you would have to pay for that out of pocket.
So that's where I want to go. So what is not covered? Because I know there are some terminal illnesses that Nigerians face, and they always need support and help. Yes, there are NGOs supporting some end, but how much of these terminal illnesses like cancer, diabetes, that you cover or you don't cover? Okay, so we do treat non-communicable diseases because we know that's an emerging thing with us here. So whether you're diabetic, you're hypertensive, you have asthma, we've even put in something for sicklers. And recently we just put in something for lupus. They approached us. Yes.
And they have an event today, which some of my people are there already. So we put in something for them so they can do this, their rheumatoid factor test. I think they have to do that like 2 or 3 times a year. So we've added that in there. The essence of a social plan is that you meet the needs of people. So if you have a request that comes in and you see that it is a need, you try and, meet those needs for people. That's really what's where.
So I wanted to...
Cancer, as you mentioned, yes, we do have facility for us to cover an element of funding of your cancer care up to $1 million. If you've been with us for over a year and you get that kind of unfortunate diagnosis, the standard plan will cover you for up to $1 million, and the plus plan will cover you for up to $2 million. For the common cancers, that we have around here, breast, etc.
Corona is the...
Oh, COVID. What government has for COVID is that we have a call line, which is free. That is also under LASHMA. The Eco Telemed is a telemedicine platform. You call 08,000 Eco Med if you think you have symptoms or whatever. And most people are asymptomatic or mildly symptomatic. So we enroll you onto home-based care. The doctors would call you every other day, follow you up. And if you escalate, then we have a response system where they'll come and pick you up and take you to. But we will now talk you through what you need to do. A COVID pack will be sent to you, and so on. So that's,
So one case question, sort of stream off. I had a different question, but just follow up. The COVID tests, if I have insurance, do I need to pay for COVID tests if I'm traveling?
Yes. Oh, yes.
Okay, but I wanted to ask about age, because for me, as you have parents getting older, it's important to have a care for them. Do you have like age benchmark that you don't cover?
Okay. So it's social. So it's for everybody.
Oh, fantastic.
If you're 80 or 85, as long as what you need is within the benefit package, we will cover you. We even have a seniors plan, for instance, now.
Wow. I need
for people over 60.
So, I'm 61.
Oh, fantastic. So what that plan offers you in addition to what we have in the standard plan is that you can have a yearly screening test done. So we partner with some diagnostic centers. You walk in and you can screen yourself for the cancers and things like that. Yes.
Now, usually when you have all these government-funded schemes, sometimes providers treat us like you're the step-cousin of the real insurance company. You're like the stepchild. So they give you the worst drugs or the less potent drugs, or, they say, this one is the cheapest, the one that pays for the years for everybody. Take that one. And so people just choose not to subscribe to government kind of scheme because it feels like it's for the Bogweru. Is that really for the Bogweru, or is this something that would they provide the same service any regular Nigerian would want to have?
So it's not every resident in Lagos is important. We have professors that subscribe to this scheme. So it's not, the quality of the drugs is indisputable. we have a list which we expect them to stick to. We have an entire quality team that goes around to do clinical audits to see the kind of drugs that patients are given, to see the kind of care that was given. And we even do some level of mystery shopping. So we walk in, we send people to enjoy the customer experience, quote unquote, and we get a feedback. That's part of what we do.
Wow. I have a hospital of 11 people.
Please.
That's a lot of
You're
people.
very welcome.
Go ahead.
I had an important question and it just so...
Oh, I'm so sorry.
I can even help because I notice when I go to, because I'm not registered under any medical insurance scheme, when I go to the hospital, you will see the hospital full with, but because I come with cash, they answer me first. So all the people, I just pity them, they're just because they're all under insurance.
Yes, that's another problem right here. You're very correct.
So that is a perennial problem, not peculiar to just Ilera Eko. That is a problem regarding all health insurance, not even just in Lagos, actually. But one of the requirements that we give, one of the criteria that we tell the providers is that you must have you must create a route for the Ilera Eko patients. When they come in, we want to see that you have some sort of arrangement to try and fast-track them and get them moving as fast. And so that's some of the things that our quality people also check when they go to the facilities.
What about the speed of verification? Because, you know, sometimes you're getting to the hospitals in emergency and they say, oh, this is your card. Let us call the provider to verify. Oh, we don't know who the person is. I'm very sorry. We just need to confirm from them. And there is an emergency that needs to be taken care of. And what are you doing to advocate for all the policies that we know should be done in terms of healthcare, like treat patients without, if they have gunshot without, because we need more advocacy. Those two things.
Okay. So we're actually working with our providers to have a service charter document. And that service charter document kind of is like a social contract you have with the people, where you will state, when you come into our facility, this is how long it's going to take us to do the verification process for you to get your vitals done and for you to see the doctor, etc. And they will be held to that. Right now, we're IT-based. I'm happy to tell you. So when you walk in, all you need to do is give us your number, and they check you in the system. So it's not a barrier. Yes, you don't. No, you do not. You do not.
Okay.
So, you mentioned the standard plan, and you know what are the class of plans that you have? And
thank you for that question. So we have a standard plan, as I mentioned, 8,500 for the individual and 40,000 for a family of 6. It was 18 years before, but now we've increased that to 23 because we got a lot of feedback that, please, my child is still at home at 21 in university and I'm the one responsible. So why are you telling me that I can't, cover that person in a family plan? So we've extended the age to 23. We have what we call a standard plus plan, which is a little bit higher than the 8,500. That's 15,000 for an individual and 70,000 for the family. The same, yes. We even have, you can do it in installments. So what we realized at the informal sector level is that, yes, I want to, but I can't pay it right up front. So we have a facility for you to, we call it Ilera Eko Pay Small Small. Every month you will now make a payment. You have a card where you have that. Yes, and then the agent that collects the money also. So there's no dispute as to whether you paid last month or you didn't pay last month. And you still get access to the same care. Then we also have what we call our diaspora plan, which is being marketed abroad. You can pay for your family members that live in Lagos. You can pay in pounds, you can pay in dollars, you can pay in euros. And we have people that are helping us to market that.
Because I hear that a lot of funds being repatriated to Nigeria goes into welfare, food and health challenges. So this will probably help those that are interested.
Sometimes you get to an emergency center and there's a crowd and, you know, they're trying to check out. Does just the presentation of your Ilera Eko card, does it give you quick access? Because they know, yes, this one is going to pay itself.
Yes, it does. In fact, you don't even have to brandish your card. If you, normally when you, I don't know if you experience that when you're, we send you an SMS immediately. So you actually even have your policy number on your phone. In case you forgot or you don't have your card with you, you can open your phone, give them the number, and they check it. And then you get access.
This sounds really good. You know, I have been looking for an insurance company, so I think I might subscribe to you guys. You know, I have a large family of 11. I have a large family, but I have 2 grandmas, you know, and they hardly go to the hospital. But, you know, it would be good for them to
have it. Do you cover annual checkups?
Yes, we do.
fantastic.
Yes, so
For the
very
seniors
important.
plan, yes, we do.
Everything. Where your body, they check you 100%.
I'll just say so that they will cover my
I just had
Thank
an
you.
It cost me a lot of money. I was like, what?
It's expensive.
It won't be all the test, too, not for 8,500.
Okay, so you're going to give us the details, right? How to
Yes.
subscribe after.
Yes,
Okay, I'll
yes, I
definitely
will.
look into it. Thank you so
Well,
much for
nice
this
having
information.
you.
Really good to know. And I love the diaspora part because many people want to send home to help their family members, but they're not sure. So this insurance is a fantastic one to ensure their parents, at least your family members, are well sorted concerning health.
Yes.
That's a great news.
Thank
That's all we can take on the show today. Tomorrow, we move on to other topics as we still observe the political class as they are picking up forms. In fact,
Today is
we
the
are
last
all
day.
coming together to buy form for YK and Nicola Kuti because she also is running for president.
So
She
can I
has
just
told
say
me
something?
privately she will soon announce
Please, when
publicly.
you are, when
Have
you
a great
don't
day.
go and buy the
We'll
form.
see you tomorrow.
Send it to my account. Send it to my account, please.
You don't
Don't buy the form.
No, we
I'll
don't
go
see
and buy the form by myself.
Okay, you run away. We don't want to buy it. Have a great day. We'll see you tomorrow. Bye.